Welcome to another episode of BVI Eye Conversations with me, Dr. Reshma Jahveri, an ophthalmologist at Suresight Eye Care, Juhu. BVI Eye Conversations is a very different concept where we have doctors who would come here not only talk about cataract, refractive surgery, as well as lot of information about the eye, but we'd like to know them on a personal basis as well. So this is a very interesting conversation that we are going to have this time, and it's going to be with Dr. Nitin Deshpande. Dr. Nitin Deshpande, who's the director of Shree Ramkrishna Netralaya, a group of eye hospitals in Thane, Mumbai and Navi Mumbai. He is specialized in glaucoma and refractive surgery. He is a member of Royal College of Ophthalmologists, London. Dr. Deshpande has performed live surgeries and presented scientific papers in the state as well as in national conferences. He is awarded as Young Achievers Award by Indian Society of Cataract Refractive Society. Hello, Dr. Nitin. How
Hello.
are you today?
Yeah, I'm fine. Thank
We are
you.
so happy to have you with us on this beautiful podcast, which is the Eye Conversations.
Yes. Thank you. Thank you for inviting me. Thanks to BVI for inviting me for this podcast. Special thanks to Sharad and Deepak, who have been great friends for past few years.
That's amazing. So tell us more about your journey, Dr. Nitin.
I did my MBBS from JJ Group of Hospitals, and then I was selected to pursue my post graduation from world-renowned Arvind Eye Hospital, where I did my post graduation, followed by a fellowship in glaucoma and refractive. And I've been practicing for past 17 years. And my center name is Shree Ramkrishna Netralaya. We started in Thane and then we are spread out to Navi Mumbai and Mumbai. Currently, we operate 6 centers across central Mumbai.
Wow, 6 centers is a lot of centers. A little bit more about your centers that you'd like to tell us?
We have always had a vision to have the best facility made available to different suburbs. If you see in the past, everybody used to travel to South Mumbai to get treatment. But over the years, we have seen that since good centers have come up in suburbs, we are able to cater and give patients world-class eye care at our centers, which are situated in different suburbs like Thane, Mumbai, and Navi Mumbai. And we always envisioned to have centers which provided world-class eye care at an affordable cost. So that's what we are doing for last 17 years.
That's really nice. Dr. Nitin, I'd like to know that, there are a couple of different concepts, like you have single practitioner, you have a group practice, and here you are a practitioner who, I think you practice with your wife,
Yes,
who's
I
also
do.
an
Yes.
ophthalmologist.
Yes.
How does this work with having so many different hospitals, and how do you manage your time with such amazing places which are there for you where you go and practice?
So we always believed in hiring people who are better than us. So all our centers are manned by consultants who have done their fellowships from reputed eye institutes, who have been consultants who have been working there for many years, and then they decided to come and join us. So each center is given, the consultant is given a responsibility of each individual center, and they drive the center. So my working pattern has really not changed over the years. It is the consultants and the staff which is motivated that drives the particular or their specific centers, and is working very fine for us till date.
So is the concept of, the patient wants to be operated by a particular doctor, and in your hospital, since there are so many different hospitals, would the patient's requirement be like they want to only get operated or be checked by you particularly, or they are fine with the name of the hospital?
So the effort has been to make name more famous than the
Correct.
individual.
Yeah.
In the centers where I've been practicing for last 15 years, probably some of them want specifically me to operate. But the new centers where I don't visit, they don't know me, and they only know the consultants, those are working there. So they are quite fine and associated with those consultants. I'm always there as a backup if anybody needs my help.
There are so many different technologies that have come in our ophthalmic field. How have you developed your centers, and what all new technological innovations that you have in your centers? Would you be able to guide us something with that?
So when I started my practice, we had a very small practice to start with. But with God's grace, my father is an ophthalmologist. So we had a basic setup to start a practice. So we kept, like we added, being a glaucoma surgeon, I first started getting glaucoma clinic done. Like we got our perimetry machine, or we had a GDX machine that time. That was the only GDX in India that time. So always believed in getting what was best technology available at that point. Then we added LASIK. We started doing refractive surgery almost 17 years back. And as technological advances happened, as software is got upgraded, like our phaco machines have seen so much of evolution for past 15 years. So we kept upgrading and getting the best technology. Last 6 years back, we got a bladeless cataract surgery machine from Lensar. And after 5 years, we have again upgraded it to a Ally machine, which is a first installation outside US.
Right.
Then we recently from LASIK, we are also trying to graduate to lenticle surgery. We got our Atos machine a few months back. So it has been a great journey. I was very happy to do a first mixed surgery in India with eye stent. And I've been doing eye stent surgeries for almost a year and a half now. So all these new technologies not only make surgeon happy that they are doing something good to the patient, but it also gives very good results to the patient. Like MIGS, there are no additional cuts, no stitches, makes patients recovery so well, or for that matter, even bladeless cataract surgery. It's a very painless and a quick experience for a patient. So all these technologies basically make patient's life much better.
Correct. So you did mention that your father is an ophthalmologist. When he was practicing, obviously we didn't have so many technologies, and
Yes.
now there is.
Yes.
So how do you think the entire practice has shifted more technology oriented, or it's still a doctor oriented? So
I
how
think
do you feel that is?
I feel the practices have become more result oriented.
Okay.
Because I remember my father doing something called intra surgeries, where the cuts used to be much larger.
Yes.
There were stitches. Even we learned stitches when we were doing post graduation.
Yes.
But world has moved to very smaller incisions. If you have seen the technological evolution in lenses, we never had those kind of lenses like trifocal lenses, EDOF lenses.
It was
So
never
all
there.
that transition has happened over past few years. The machines have got far better than what we were using in our post-graduation days. The chambers have become stable. Your next day results have gotten better. Even the mix evolution we have seen over past few years only. So all those new things, new drops, new surgeries, it's always I think ophthalmology is a very fast moving field.
Yeah.
And it is probably one of the fastest moving fields among the medical fraternity.
Absolutely.
And we have to keep learning and keep upgrading. And I think it's a joy for ophthalmologists to learn new things. And at the same time, you are doing something good to the people by doing that.
So
a
I
great
think
thing.
it's quite a balance. It's a boon and it's a bane, and it's like you're giving the patient that kind of advancement in treatment, but it also is heavy on their pocket. So how do you really balance that, and how do you make it for the patient to, because a lot of patients come in and say that, oh my God, there's so many different investigations we've done. Is it really required? So how do you give that explanation to the patient?
I think if you educate the patient well, they understand what you're doing.
Yes.
Like simple things like doing a dry eye evaluation before doing cataract surgery. Now we know that that makes a lot of difference to the visual outcome, because your cylinders vary so much if you don't do a dry eye test. But if you tell this to the patient that I'm doing this so that you get a better result,
Yes.
then I think they understand. It is about conversation and convincing the patient and telling him what you're doing and why are you doing it, because at the end they are the ones who are going to get benefited.
Correct.
So I think although it's expensive, you tell them that this is for you, this is for your eye, and you're going to see better because of this. I think most of the educated class understands this very well, and they're happy to get those procedures or those surgeries done. Those who can't afford, you always have an option open. There is no injustice done to them also, because otherwise technology has evolved so much that there is no injustice to anybody. But those who can afford, those who understand technology, and those who want the best, there are options available.
So I think it's all about how we counsel our patients.
Exactly.
I think that's where they also, as you rightly said, they understand and then they can go ahead and they don't feel such a big crunch on their pockets.
Exactly.
Tell me more about yourself, as in you said your wife is also an ophthalmologist. How does it, the whole parameters work at home, on the dining table, in the hospital? So how do you manage this entire thing?
So at home, we try not to discuss ophthalmology as much as
As
possible.
much as possible.
My
Okay.
kids don't want us to talk about hospital on the dining table.
They are not
say,
doctors. I
please
mean, they are
don't
not
talk
getting
about.
into medicine.
They are. My elder one is doing third MBB. He's in third MBBS in KEM now.
Okay.
So they want to get into it, but we try to restrict our work-related stuff in the hospital. Um, so after the whole day, we do meetings, and when we come home, we would like to be in the family atmosphere, and we want to discuss other things in life. So we go for an evening stroll. We have chit chat at the dinner time. So I think it's good not to mix your work and your family life. And after COVID, we have restricted our timings also. We used to work whole day. Now we work 9 to 6. So after that, it's a family time, and we are able to spend time with our kids because they are growing fast, and I'm sure we'll not get this time with them later.
Absolutely.
So I think work-life balance is very important.
So you actually manage from a 9 to 6, covering 6 hospitals. That is really nice. If you have a patient who's coming into you and vis-a-vis you have a family member who walks in, is there any difference in the way you treat them or the way you counsel them? Or is there any like a VIP syndrome when there is a father, mother, or any relative that walks in? Or do you think all of them, the treatment that you offer is pretty much the same?
Luckily, I got to operate on my mother recently.
Okay.
So I can tell you about that.
Yes.
Well, the counseling part was much lesser with my mom. Otherwise, a patient, I would talk more in detail. I would like to explain them because my mom knows what's going on because
Yes.
she's a physician. But otherwise, a layman, I would like to explain him more. Otherwise, there is no difference. When I was doing a surgery on my mother's side, I felt I was doing surgery for any other patient. So there was no different emotion or there was no different stress or so I think every eye is important. You want to do best for everybody, and I think any ophthalmologist would or any medical practitioner would always wish best for his patient.
Right.
So I don't think that would be any different for my family member or any third patient. When you are a patient and you are on a table and when you're operating, you really have no other thought but to do best for that person.
So which lens to use for your mother was your call or was it her call?
I knew her requirements. So I think lens decision is very much based on individual's needs. So I knew what her requirements were. She wanted to be free from glasses. She was a plus powered for far and near. So I thought a trifocal lens would be best for her. And she's very happy now because she doesn't use glasses anymore. So it's very individual decision. She doesn't drive at night. So
halos didn't matter.
Halos and doesn't matter.
Yeah.
So I think decision of a lens is very individual. You need to really talk to that person, ask him what he wants. Evolution of new generation lenses like extended depth of focus lenses have changed my mindset a lot. And last few years I have largely shifted to EDOF lenses, which I feel offer the best of both worlds. Like monofocal, you can't see near. Trifocal, you see everything, but you occasionally get halos. See, I don't discourage patients using trifocal. I still use large number of trifocals in my practice, but I tell patients that what to expect out of that. If they're happy to accept halos for first few days after surgery, I give them a very simple example. Like you see your nose, you are able to see it, but you don't feel it because your brain has accepted that that it's there. Same way, a person is going to experience little halos and glares or rings for few days after surgery, but after few days you get used to it and your brain filters.
Correct.
So your brain is an amazing organ that filters unwanted things.
Yes.
So I have very happy trifocal patients. At the same time, I have very happy extended depth of focus lenses. Just to add to this, so why switch to a extended depth of focus lenses? How this journey began, that I see a lot of glaucoma patients, and you know diabetes is very common. So in glaucoma patients and in diabetic retinopathy patients, trifocals are a relative contraindication. So that is, and when they want some good premium lens and they want to see for near also, then probably EDOF was a good option that I could offer them. And that is how I started using EDOFs, and now that's large part of my practice.
So there are these different kind of lenses which are monofocal, EDOFs, multifocal, trifocal. Can you just explain, just in brief, what are these different lenses, as in what lens has what function? That is A. And second is, how do you explain to your patients what that lens is going to offer to them?
Yeah. The initial generation lenses were monofocal lenses where you can see far very clearly, but for the intermediate task and for near, you need to wear glasses. Now, in the previous last few years back, there was not much of an intermediate work. Either you used to read books or you used to see far things. So intermediate concept evolved over last few years. So why intermediate became important? Because our iPads came to a
Yes.
intermediate level. Uh, but for housewives, I tell them that it's like if you're cooking, it's your
It's your
cooking range or your cooking platform. That's the intermediate zone almost. So I tell them that if you go for a EDOF lens, which is again a evolution of a monofocal lens, where you see far and intermediate clearly, but reading you still need a glass. But adding that intermediate vision makes a big difference to their quality of life and day-to-day work, because they are able to work very efficiently for example, cooking, or if somebody is an executive who works on a computer, large part of his work can be managed without glasses unless fonts are very small. And we have now good combination extended depth of focus lenses that gives you almost as good effect as a trifocal.
Yes.
Just adding to the conversation, what is a trifocal is like foci, it's like three foci. Foci. So you see far, you see intermediate and near without glasses, but you have to have more chair time with the patient when you do a trifocal because they have rings on them. What is the function of a ring is it splits the light into three parts, and your brain correctly learns to pick up the part that where,
They want to
where
see.
where it wants to see.
Yes.
So if you tell the patient what to expect, so like for example, somebody who drives at night a lot, I would not do a trifocal because at night it would cause more halos. But again, I tell them like I also drive at night, but it's occasional. So for the kind of advantage a trifocal gives, the disadvantages are minimal and you get over them. Most of them get over them. So I offer them all the options. I look at what their lifestyle is and then tell them probably I would do this for you. Probably this would suit you better. And after that conversation, whatever we decide, we go ahead with that.
So I have a little tricky question for you.
Yeah.
I see you're wearing glasses.
Yeah.
So if you were to undergo cataract surgery, which lens would you choose for yourself?
Currently, I would prefer a extended depth of focus lenses because they offer a good contrast. Contrast means ability to differentiate between two far things. So it gives a very good contrast. We have done studies with multiple extended depth of focus lenses. We found that all of them currently are offering a good contrast. Contrast is very important for your satisfaction of seeing things, seeing colors. So that is the lens of my choice, and of course for intermediate also it gives you good independence, and for fine reading it's okay to wear glasses. But as the EDOF technology is evolving, I think it will catch up with trifocal pretty quickly.
Yes.
There are some limitations to a EDOF technology because of optical principles, but somehow we learn to bend it and make them better over the years.
Yes. So is there any particular age that you would recommend these lenses? Like, if like, for example, an older one, you'd advise a trifocal, or a younger one trifocal. Is there any particular age specification you have?
It again all depends on the lifestyle of a person.
Yeah.
Somebody who is not going out much or primarily at home, not using computers much, trifocal would be fine.
Right.
But again, you have to talk to the patient what he wants.
Yeah. So at the end of it is what the
see,
patient
lifespan
really
is
wants.
increasing. People are active for longer periods. Even I have seen older people dancing and doing all the things, doing hiking. I have a friend who has done Everest at the age of 60. So I don't think any young person is more active than him. So the definition of young and old is changing a lot. I think it's best to ask person what he likes to do and choose lens accordingly.
So there are so many companies right now that have lenses, and we know we have an array, like a menu card of lenses. Which would be your preferred lens, and any particular reason why you are, like focusing on that particular lens, or anything that you feel is going to help your patients better?
I think more or less the industry has been very responsible. I would won't say that any lens is bad today.
Yeah.
Most of them have the best of the materials, best of the technologies. But I would look at the pedigree of the company when I decide the lens, because those companies which are global, which are around for longer period, and they have a good track record, I would select that company. Um, I would be a little skeptical. I don't jump easily into the new lenses. Uh, I think the track record and the pedigree of the company would matter a lot.
So, Dr. Nitin, I've heard that you are one of the biggest users of PVI lenses in the western part of India. Any particular reason why you have chosen these lenses?
When you select a lens, the pedigree and the trust is very important. BVI is around for 75 years. That's a long time. And they're into this lens business for almost 35 years. And large part of lenses, those are made globally. The material is supplied by BVI. I think this gives some weightage to the company that they are very trustworthy. Myself, I have used their lenses a decade back, where they were the first company to launch this presbyopia correcting lenses or trifocals. And that was the first time I got very good results using a multifocal lens. And I was very happy with those lenses a decade back. So the association has been almost a decade long, and they have always evolved. They have brought in new technologies, and that has worked great for me, for my practice. And they have been a great support for almost a decade now.
And of course, the results that come in with the patient's vision and acceptance.
Absolutely, absolutely.
I think that gives further confidence for using these lenses.
Absolutely.
And as far as the technology that you've been talking about, anything that you have used in your all these six centers that you have that is very technology friendly, user friendly, doctor friendly. So can you tell me, I mean, what would you prefer as far as investigations or these technologies are concerned?
So regarding lenses, besides being very good lenses optically, they have great features like they are preloaded. So that makes surgeon's life much easier. Not only lenses, but their other products like their blades are of a very high quality. Recently, I started doing lenticle surgery, and I was very impressed with their lenticle dissectors. So they have a large array of surgical equipment which are very high tech and very well-made instruments. So they are offering a whole bouquet of services to ophthalmologist.
Even I am trying to set, I mean, I have my own OT and, I'm looking into new phaco machines.
Yes.
And I think their phaco machine also is
Yes.
fantastic.
Yes, their Opticon machines
Yes.
have a very good reputation.
Yes. Have you had patients who've had these very, different misconceptions about, cataract or about the cataract surgery? Have you had any of those incidences in your clinic?
Yeah, you hear all kind of funny things from patients. And one thing they are concerned about is season. I don't know why, because in Mumbai or in North, there is a misconception that winter is the best season for surgery. But practically, season doesn't make any difference. Your outcomes are as good throughout the year. Secondly, there is an expiry written on the lens package. I think that is something people are really concerned about, because they go home, they see a particular date on the package, and
expiry date. Yes.
And they are worried that their lens will expire. But I always tell them that the expiry is for the packaging and not for the lens. Lenses are for life.
Yes.
Then another question I get routinely is, Doctor साहब हमने आँख मल दिया तो क्या lens हिल जाएगा?
Yeah.
I tell them that this lens is never going to move. And I tell them that after a month, they really don't have to worry or bother about the lens at all. ये lenses permanent है, ये fixed है. तो आँख मलना या so of course they have to maintain a good hygiene post surgery for a few days. But after that, it is as good as their natural eye, and they should not worry a lot about that. And these are the common ones I really hear. These things I hear normally.
Yes. And I think one of the other questions also they keep asking is, can we do both eyes together?
Yeah.
So what is your take on, can they get both eyes cataract done, or would you wait for, one to settle down and then go ahead with the other one?
So I think every clinic follows a different procedure. There are many clinics who are doing both eyes on the same go, especially some people like some challenging cases like mentally retarded patients, or those patients who can't come back again and again for second eye. So in such special situations, I would do them on the same day. In my practice, we do separate two eyes with at least 3 to 4 days. But there are many practices doing same day surgery successfully. I think either way, whatever you feel comfortable, what you know your systems well, so you should follow that.
So you have a general guideline of how to treat patients. Is there any particular philosophy, or like a set pattern, or it varies according to different patients?
Our practice, we try to make it as patient-centric as possible. Educating patient well is extremely important. And right from the person who attends the door till the doctor, everybody needs to be good to the patient. We have to give patient a very good experience when they come to your clinic. It is not just about a good treatment, but patient should feel welcome. He should feel happy when he leaves your clinic, and he should get what you told him he would get. So his expectations should be, of course, set right when he comes to you, but then you should deliver what you promise. So I think these things really help in making patient happy, and then he refers more people to you.
It's not just about, one consultation. It's mainly
Correct.
about the entire experience that they
Yeah.
have in the clinic.
And the best part is it's a relation that you develop.
Exactly.
Like for example, glaucoma patient, he keeps seeing you over years and years. And I'm seeing same, maybe I have some patients who are coming to me for 17 years now since I have started practice. So I think it's a relation building, and that each patient will get you more patients. So, and it's like I always say कि जो माला बनाते हैं ना, एक एक मोती लगाना पड़ता है. So you have to add each patient to your practice, and that is how the mala comes
Yes.
into being.
So it's that one patient who would tell the other, and that's how the whole
Yes,
practice
yes, every
develops.
patient is important.
And do you think that this whole practice that we are having, especially now since you have 6 centers, how much is it dependent on Google, or how much patients you really look into the online and see for ratings and all? Has that uh, given added advantage to your practice, or it's more of local and more of by word of mouth?
Still, the strongest thing that drives him to your patient, to your clinic, is word of mouth. But the second most important is digital now.
Correct.
Because this world has digitalized a lot. Modi ji has brought phone to each household and each hand. And you see the mobile marketing spend and the influence have grown exponentially over the last few years. And every patient that comes to you who doesn't know you will first go to the net, check your reviews. I think reviews are very important. Every clinic should make efforts to have maximum good reviews, of course genuine ones.
Of course.
But then your reviews make a big difference. Your presence, your when the patient browses for an ophthalmologist, if you on a SEO, if you come up at the top, then that really helps your practice. I think digital presence is very important. Then podcasts like what we are doing now, because many people would like to really hear about what you say. They want to know from others how your clinic is, because it's a precious thing that they are trusting you with. So I think patient will definitely hear from their neighbors, will go to the net and check you out. They will check what kind of services you're offering. They will check what experience other people have, and then he makes or she makes a decision to come to you or go to some other place. I think the whole ecosystem has to be working for you, and so that the patient comes to you.
They have so many concerns when they come to you, especially when it's, as you rightly said, it's a very precious organ. And, so how much table time do you actually give them? How much counseling? Because you have questions like, oh, हमारी आँख चली जाएगी तो, कितने सारे ऐसे myths है कि नहीं cataract किया तो शायद आँख चली जाए. It's not like, of course, there are times where vision has gone, but it's not every time you do a cataract surgery and you land up in a complication. So what is a table time that you offer your patients?
I think people are quite educated nowadays. They would have read a lot before coming to you, so they know a lot of things. So I don't think you have to spend a lot of table time, but I think you have to tell them some specific things. Those are important, and especially things like glaucoma, which people don't know much about. Those patients take a much longer table time. But cataract and other things which are more common, people would have heard more about them. So table time is little less, and then you have your other staff to help you, which once you tell them some key points, it's my counselors take over and they explain in more detail. And of course, people are welcome to come back and ask me if any queries they have. So it's the system that helps a doctor give more and better information to the patient, and not at the same time not spending too much of table time with the patient. But of course, if somebody wants to know more about something, they are most welcome.
So last question on this, that you are a glaucoma surgeon. Can you just give a short brief of what glaucoma is and why is it important to get oneself checked on a regular basis?
So, glaucoma, your eye is turgid because of the fluid inside the eye called aqueous, and your God has given you autonomous system. That fluid is formed and flows out, so that the balance of incoming and outgoing fluid is maintained. But when this balance is off for some reason, say there is a block or something that happens in this pathway, then there is excess fluid inside the eye, and the pressure in the eye rises. Now, your nerve is made up of millions of small fibers, and it arises from cells called ganglion cells, which are pretty sensitive. And when the pressure goes up in the eye, these cells start dying, and that is how you start losing your peripheral vision. Now, when I'm looking at you, that's my central vision, but I'm aware about my surrounding. That is my peripheral vision, and this peripheral vision slowly starts coming down. Unfortunately, you are not aware of your peripheral vision much, so people realize losing this vision very at a very later stage. Even in India, after so many advancements, still 50% of people come to a specialist when one eye is lost. And prevalence of glaucoma is very high. You know, 1 or 2 persons out of every 100 have glaucoma, which is a very large chunk for a populated country like ours.
And it's an irreversible damage.
Yes, it's irreversible damage. So it is very important to detect this disease early. Then it has a genetic predisposition. That is, if your blood relatives have glaucoma, like your mother, father, your siblings, then your risk is 5 times more than a normal person. So I always emphasize that every person should check their eyes at least once in a year. And if you have any blood relative, then you have to be really more conscious, and you have to make sure that you visit your ophthalmologist regularly.
And I think it's also very important that we should, tell the patient that check individual eyes, because sometimes because God has given us 2 eyes and they don't realize that one eye is getting
Absolutely.
affected. So
Absolutely.
once in a while, if we ask them to, close one eye, and if you can just quickly give a home way of checking investigation, how to check for peripheral vision.
So we do something called a confrontation test,
Yes.
where you face each other and just bring the finger
Correct.
in. A normal person would be able to detect that finger at a much farther distance than the person affected. Affected person probably would see it when much later than the. So that gives you some idea about
Yes.
something is going wrong.
So Dr. Nitin, we have had a lovely conversation so far.
Yes, absolutely.
And now let's move to something more fun.
Yes.
I will ask you a couple of rapid fire questions and I'd like you to answer it in one word.
Yes.
All right. So tell me, which Hollywood or Bollywood movie character would you like to play, if at all?
I have been a movie buff all my life, seen so many movies, and I love watching movies. When I was young, I used to love Clint Eastwood movies a lot, and then the Jackie Chan movies. And my favorite was 36 Chambers of Shaolin, because I loved karate and all those movies when I was young. And all of us have seen Amitabh Bachchan from Angry Man till what he is today, and you have seen his evolution, and you have seen how the actor can transform himself, fill himself seamlessly into different roles. I think he's a role model for everyone. So
Absolutely.
So these are the people whom I love. So.
One guilt-free feeling, like, probably having sugar or exercising or time with family, what would you choose?
Chocolates.
Chocolates.
I love chocolates, and I can eat as many as you give me, but my family wants me to slow down because I'm 47 now, but I'm not slowing down. I love chocolates.
Okay, that's nice. Are you a dog person or a cat person?
Dog person, absolutely. I think they are very loving. They are very, they are like a family member. I lost my dog a decade back, and I had a beautiful Alsatian, and I really miss him.
One person that you cannot live without. Please say your wife, because she'll be watching later.
No, otherwise also I'd say wife, even if she's not watching, because we are married for almost 25 years now,
nice.
and it's been a lovely journey.
That's nice. Are you a mountain person or a beach person?
Beach.
What is that one word your friend would describe about you?
Friendly and down to earth, probably.
And your favorite emoji?
Smiley.
Smiley. Thank you so much. Thank you for coming on this show.
Thank you so much.
Thanks a lot. Dr. Nitin, this has been amazing to have you on our sets today. How has your experience been so far?
Thank you for inviting me again, and it's been an excellent experience talking to a fellow ophthalmologist whose questions have been very weighted and to the point. So I really enjoyed talking to you. I also like talking for BVI because such good brands should reach out to the people.
Yes.
They should know about good companies, and overall experience was great. And it's nice to talk to the people, tell them about different eye diseases, and they should make more informed decisions.
So this was Dr. Nitin Deshpande today on our podcast of BVI Eye Conversations. He is the owner of 6 hospitals of Shree Ramkrishna Netralaya. And we are so happy to have him over. Thank you so much.